our next presentation is a public health presentation related to airport and aircraft exposure. And we have as our guest, Dr. Kris Johnson, Ph.D., Public Health, Seattle, King County. And I just want to give a little bit of background in that this is information that the city of Burien shared with our airport city partners. And it was information that was found very compelling actually by our START partners. And so we wanted to bring it forward here to the city council. And because Boulevard Park is under the flight path and we're moving towards a comprehensive plan in that area, I think this is information that the council should be aware of. So thank you, Dr. Johnson, for coming, and I'm just going to turn it over to you.
Well, thank you for having me. This was a study done by, here, you're going to watch me practice the slides. It's been a while. All right. I might need you to click for me. Let's move. So I'll say next slide. You're going to have to tolerate that. Thank you for your patience. So this was a study that Public Health of Seattle and King County conducted in 2019 and 2020. It was requested by the Washington State Legislature. We're very grateful to Senator Kaiser and Representative Orwell for their support designing the ask and then making sure there was funding for it. This is not a health impact study. The health impact assessments are much more formal. What we were asked to do is what you see on the screen. We were asked to do a comprehensive review of the literature. What do we know about airport-related pollution and its impact on human health? And then we were asked to use available data to look at community health in those communities within 10 miles of the airport. The concentric circles that you see are what we looked at. And again, this was based on the ask of the legislature. So the first circle, we looked at communities, residents who lived within 1 mile of SeaTac Airport, between 1 and 5 miles, and then 5 and 10 miles of SeaTac Airport. Please note, so there's air pollution that comes, what we learned is there's air pollution that comes from airport operations, both ground vehicle and also the airplanes themselves, aircraft. There's also within these concentric circles, we just need to acknowledge that there's also the King County Airport, municipal airport, and then I-5 and 99. So you've got other sources of pollution there. Let's see, did it work? Oh, you're doing it, sorry. Did I do it too? This would be the comedy portion. So one of the things that we learned right away, and I'm relatively new, I've been here about 3 years from the Midwest. One of the things that we learned is the majority of King County's people of color live within 10 miles of SeaTac Airport. It is, if you look at 75% of Native Hawaiians and Pacific Islanders, almost 75% of Black residents and African-American residents. And it's true, right? Over half of Hispanic or Latino residents live within this area. And from now on, when I say airport communities, I mean communities within 10 miles of SeaTac Airport. It's also about half of our Asian residents live here. Compared to the rest of the county, this area also has a slightly higher but significant proportion of children and immigrants residing. So that was the first big find, right? Is that by and large, it's communities of color that we're talking about. Overall, what we saw compared to the rest of the county is that these communities face both health disparities and resource disparities. In some cases, for a few outcomes, we were actually able to see that the closer one resides to the airport, the worse the conditions. For example, hospitalization rates for heart disease were highest for those who live within 1 mile of SeaTac, slightly lower for those who live within 5 to 10 miles, or sorry, 1 to 5 miles, slightly lower for 5 to 10 miles. And then all of those 3 rates are significantly higher than those of the rest of the county. So for the outcomes that you see on the screen, life expectancy, rate of death from heart disease, rates of death overall, and then hospitalization for heart disease, there was that correspondence where rates were highest when you were most proximal to the airport. Now, this is not, again, this is a descriptive analysis. So this is not causal at all. We can't say that these outcomes come from pollution. We can only say that these communities are already at risk. Because we don't know, right? For example, heart disease, right? There's other causes out there. So what we do know is that there are, right, the communities face health disparities, and those health conditions that put them at risk run through the life course from birth to death. So for example, mothers in airports communities are 43% more likely to have a premature birth than mothers in the rest of the county. It's not shown in the data, but it's also true that they're more likely to have children born with low birth weights. And then airport communities have twice as many children living in poverty compared to the rest of the county. And again, not shown in the data, but it's also true of adults. There's a higher percentage in airport communities of adults living in poverty compared to the rest of the county. Adults are more likely to be uninsured in airport communities than they are in the rest of the county. Airport communities also have a higher rate of hospitalization for a number of outcomes. There's a higher rate of hospitalization for heart disease, for stroke, diabetes, and then also for asthma that I'm not showing you, and the COPD, the chronic obstructive pulmonary disorder. The bar charts I want you to be able to see, the one on the left is the rate for the community that lives within 1 mile of SeaTac Airport. The next bar to the right is the 1 to 5 mile range. The third is the 5 to 10 miles. And then the last bar on the right is for the rest of the rate for the rest of the county. There's also a higher rate of deaths overall, I mentioned, in these airport communities compared to the balance of counties. And then that significant difference we also see within types. I mentioned heart disease, stroke, and a few others. So again, we're seeing that these are communities already at risk. They've got health conditions that can be aggravated, like the asthma, diabetes, that can be aggravated to exposures to pollutants. We also, I mentioned, conducted a literature review. A lot of this, when we conducted the literature review, we used the same methods, because I'm going to talk to you about what is a causal relationship and what is not. We use the same methods that the EPA, the Environmental Protection Agency, uses when they do their impact assessments on pollutants. So we did a strength of evidence analyses. And when I talk to you about there's a causal relationship or a likely causal relationship, meaning one causes this to happen, that is based on numerous studies with rigorous methods. So when I'm saying, right, so we adopted the same guidelines that the EPA uses in their review. And what you see when we're talking about pollution that comes out of the airport operations, we're talking about air pollution and noise pollution. The noise pollution, you all, I'm sure, are aware of what I'm talking about, right? I can stand at Saltwater Beach Park and I can count the flights going over me, right? We can all hear it. The FAA has a noise level threshold that is lower than that of what the World Health Organization recommends. So it's just interesting that there is this fight around standards, but the noise pollution definitely has an effect on health. It primarily affects attention and focus, and it's primarily through lack of sleep and stress. The air pollution comes from a number of sources. We've got the ozone and carbon dioxide. There's a number of hazardous air pollutants that are in there. We've also got particulate matter, which comes from things like smoke. But it also comes from plane exhaust and vehicle exhaust, and it comes in different sizes. But the air pollutions across the board are the air pollutants that stem from the exhaust that comes from planes and vehicles, cause respiratory problems, including asthma, the COPD that I mentioned. The air pollution exposures also cause cardiovascular issues, hypertension, which is high blood pressure, heart disease, heart attacks, and stroke. There's also nervous system implications, right? So exposure to air pollutions can cause dementia and can cause oxidative stress. The oxidative stress system is what monitors our overall biology, right? And can change with different exposures. The metabolic issues, I mentioned diabetes, and then reproductive health concerns. There's a number of studies out of Los Angeles right now that show that particulate matter that I'm talking about, particulate matter at the size of 2.5 and then very, very small. And all of this particulate matter is smaller than, right, a grain of hair. Some of that particulate matter can pass through the bloodstream, and so then does cause preterm birth and low birth weight. There's also a new study suggesting that it causes brain cancer. We don't know, when I say exposure to these air pollutants, we don't know exactly how much exposure, but through animal studies and studies of large populations, birth cohorts, we know that exposure causes harm. We might not know how much exposure, but we know that exposure causes harm. So that was the summary of the literature review, right? Is that we understand now that there is this causal impact on health that is negative. What we also wanted to know, I mentioned exposure. We wanted to know, well, what do we know about exposure here? We definitely, in the literature and in studies, we need to better understand what amount of exposure leads to these health conditions that I mentioned. Locally, we know there was a 2018 Beacon Hill study that showed that the noise levels resulting from planes going overhead did surpass that FAA threshold. And that threshold was set based on our health. So noise levels from planes have, in 2018, we have data that shows that it surpassed levels that were set to protect our health. We also know the 2019 Puget Sound Clean Air Agency shows that particulate matter levels were over EPA recommendations. So we basically had some early data that shows that occasionally we're surpassing limits that were set to protect our health. We don't know a lot. We also, when I'm talking about air pollution, that ultra-fine particulate matter is not regulated by the EPA, the Environmental Protection Agency, and so we don't know as much about it. So at the same time that the Washington State Legislature asked us to do this examination of existing data and a look at the evidence, what do we know to date? They also asked a University of Washington Seattle team out of the Environmental and Occupational Sciences Division to look at this ultrafine particulate matter, because it's very new. So again, particulate matter comes when we burn things, when we're burning fuel, when we're burning wood stoves, right? It's what makes the air hard to breathe when we have wildfires. And it comes in different sizes. What this team learned, what they wanted to do was look at the concentration of ultrafine particulate matter and understand how present is it in plane exhaust and also ground vehicle exhaust, car and truck exhaust. So they studied it in two ways, and they're basically trying to measure the concentration of UFPs, or ultrafine particulate matter. Why we're worried about ultrafine particulate matter is because what the animal studies have shown us, it is so small, it actually can travel through the cell barriers, and it causes inflammation in the lungs and inflammation in the brain. So the ultrafine particulate matter most directly leads to inflammation. And again, passes through cells, so it can travel through the bloodstream to different parts of the body. So that's why we're worried about it. And that's why we're worried that it's not regulated right now and not very frequently measured, therefore. What the UW team did is, over the course of a year, there's some fixed air quality monitors. Like I think there's one in Beacon Hill. And so they looked at fixed measures and took them, right, from these systems that measure air regularly. They also did mobile measurement. So they drove the paths that you see back and forth over the course of a year to measure air quality. And then they also at the same time measured temperature, wind, strength, et cetera, all the things that they need to know. They learned a couple of things out of their measurement. One, they learned that the pollution that comes from plane exhaust really does look different than the pollution that comes from cars and vehicles. That matters because it means we can track back sources. Prior to this, people were saying that you couldn't separate the difference, and that makes it hard to look at relationships. So it turns out, right, that we really can measure the difference. And there is ultrafine particulate matter that comes both from vehicle transportation and also plane exhaust. So their findings overall is that ultrafine particulate matter is a byproduct of burning both types of fuel, right? So it comes out of plane exhaust and car exhaust and truck exhaust. The concentration overall isn't distinguishable, but when we look at the type of pollution and the amount of ultrafine particulate matter, we can tell the difference between plane exhaust and vehicle exhaust. There's more ultrafine particulate matter coming out of the plane exhaust at a higher concentration. And then the fixed site monitoring was a way of double checking the mobile monitoring, and it showed the same patterns, right? Mayor Aragon mentioned the flight path. The concentrations were highest when planes land compared to takeoff, and the UW team is not quite sure why. So they've continued their work in part with the city funding. So thank you. They did some work with schools that the city's funded, including City of Burien, and thank you for doing that. They've done some work looking at air pollution and what is outside compared to inside. What that work showed is that by and large, the air pollution that we have outside is very easily traveling inside. So for example, there were a number of schools where they tested the air quality, and the amount of air pollution found outside the building was equivalent to that found inside the building. And we're not sure, it depends, it can change different times of the year. That might be because windows were open, it might be because of the ventilation system. But one of the things that they learned, right, is that this air pollution is coming inside at high rates. But the second piece of it that they tested and shown is that portable HEPA air filtration cleaning units can effectively reduce the indoor air pollution. And again, they've tested that primarily in schools. So there is a way to mitigate exposure to air pollution, particularly for children. The other things they want to look at, there's a different team, the UW Earth Lab is looking at whether vegetation helps. In my opinion, the field's not very clear. Vegetation and trees help mitigate certain types of air pollution, but we don't know yet. There's some research that shows that it might be some types of leaves, not other leaves, right? So you have to have the right type of leaf, and it might be that we need big areas of greenery and forest and vegetation in order to effectively clean the air, right? So having sporadic trees might not do it. There's one study that basically hypothesized that we have to have 200 square meters of forests in order for green space or greenery to help with air pollution. But there's a team at the UW that's going to study that, so we'll know more soon. And then the other piece they want to do is look at the content and better understand what is coming out of plane exhaust, what is coming out of vehicle exhaust, so that we can understand that a bit more. So that's some of the work that they're going to be doing. We're nearing the end, so if you have some questions, let me know. I wanted to make the point before we talk about next steps and recommendations, just that we know that airport communities face a number of challenges beyond the health disparities and the resource disparities that I talked about. What you're going to see on the right this is from a Seattle Times article about redlining. So we know there's this correspondence between historical and structural racism and these airport communities, and that matters. because it indicates that we have some responsibility, maybe beyond general protection of human health. If we want to make progress toward equity, then we need to be able to protect health in these communities. The graphs that you'll see underneath, the figure in green, it's very hard to see, but I wanted to just have you see the shape and understand that we're talking about the same region of King County. So the map with the green background is rates of asthma hospitalization. And you'll see where the darker colors are is where the rates are higher. And then the box or map to the far left is King County's social vulnerability index, which is based on a number of factors, including income, level of housing, things like that. But the social vulnerability index indicates that these are populations that are facing disparities and have suffered from historical and structural racism. And so this cumulative risk matters because there's a lot of data out there. So for example, when we all breathe in air pollution, those of us with asthma or respiratory issues or diabetes or are more obese are going to struggle more and are more likely to suffer adverse health effects at breathing air pollution than other people are. So some of these health disparities that we're talking about put people at greater risk when they're exposed to the same levels of air pollution. And then we also know that people within these communities are more likely to be exposed compared to those of us who might live in Seattle downtown or other parts of King County. So that was a quick overview. The recommendations are very general. Again, this report came out in 2020. The recommendations are general because it's going to take action at multiple levels in order to protect human health from air pollution and noise pollution that is airport related. There are things that can only be done at the federal level. They regulate the flight paths. And there's options. There's a number of programs, like there's a federal improvement, I always call it FIP. It's Federal Improvement Project, but you basically can petition. So the Port of Seattle can petition FAA for money and then invest it in the communities as a way of mitigating adverse health effects. So there's options like that that can be done at the federal level, and then there's things that can be done at the state, and then there's things that the county can do. But overall, what we recommend is addressing the health disparities of airport communities. So if we improve basic health, if everyone's got access to health insurance, if everyone's got access to health care, then we're investing in protecting their health. And so increasing health equity is going to protect people a little bit. So we should do that. We also should continue to think about how to mitigate the health impacts of airport exposure to pollutants. I think the other thing we can do is continue to do research. It would be great to further develop and have a systemic monitoring system so that we understand air pollution on a more comprehensive level, right? So a systematic monitoring system. And then I think supporting research to further address our gaps in knowledge. But there's certainly a lot that we can do to mitigate exposures. And I think the HEPA portable air filter units are a move toward that direction. There are references, if you want to share the presentation, the UW team has a number of pieces out. There are policy briefs, web pages that are easy to digest, not long academic studies. And then the report that I mentioned is online with an executive summary if it's useful to folks. So the presentation, I don't know if folks can access it, but there are notes in the notes section that link you to other materials. And then just let me know if you have any questions.